If you are a skilled practitioner and your complex cases are not progressing the way you expect, I would love to offer you a different lens. The issue may not be that you need yet another technique. It might be that you need a different clinical container. Because in complex cases, good technique is not always enough. You can have brilliant hands, brilliant methodology, you know the anatomy, you understand trauma, you can be intuitive, you have decades of training, you deeply care about the person in front of you, and still the work may not be landing or holding. And we wonder, like, what am I missing? Do I need another training, another modality, another release technique, another way to explain the nervous system? And sometimes new tools are useful, truly, but often the deeper problem is not the tool itself, it's the sequence. It's the readiness, it's the capacity. It's the difference between creating change and creating change the system can actually integrate. And that distinction is everything. I'm Dr. Satya Sardonicus. I'm the founder of NeuroFascial Flow Method, and this channel is about the body-based missing link in healing, resilience, and human potential. Today, we are talking about why good techniques fail in complex cases and why the future of clinical care needs to shift from fixing to facilitating the system to heal itself. So, if you've been practicing for any length of time, you've probably noticed something subtle or maybe not so subtle has shifted in the last 5 to 10 years. You might do work that used to land really well and create tremendous results. And these days, it seems like it's not holding the way that it used to. There are more and more people whose response to our care is not really what we'd anticipate. Clients might feel better in the moment. You loosen something, you shift something, but it slips back and the old patterns reappear. And oftentimes, it's easy for us as providers who are big, empathetic, like big-hearted. We internalize it. We think we're doing something wrong. But what if the system you're working with is actually what has changed? And what if its ability to reorganize, that is what's different? The gap between really, really wonderful care and lasting results is widening. I was not that long ago on a call with Tom Myers, the brilliant author of Anatomy Trains, which is the foundational text for mapping out fascial lines in the body. And he said something to me that just made me go, oh my gosh, yes, this is exactly the thing. We were talking about this exact phenomenon, and he said, it seems like the stress load people are coming in with is accumulating faster than I can shovel it out. And I had to laugh, but it's so deeply true. Like, we're seeing more and more bracing and buzziness and defensiveness in the tissue. We're seeing more and more regression even after otherwise successful sessions. So it feels like we're all trying to like plant really brilliant seeds in soil that doesn't absorb water. And the answer isn't to find stronger seeds or force them deeper into the dirt. The answer is tending to the soil. So in the healing arts, we're often like, you know, how there's that image of a bunch of blindfolded people touching an elephant. Have you heard this parable? We all have these like blindfolded people arguing about what they're touching. One person feels the tail and is like, this is definitely a rope. And another touches the leg and says, no, 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 it's definitely a tree trunk. And another one touches the trunk and says, you're all wrong, it's a snake. But they're all touching literally the same elephant. And in healthcare, we do this all the time. Because of our hyper specialization, especially in Western society, we tend to go straight into treating our one piece of the elephant. But I would like to invite you to think about the body through the lens of biotensegrity. Imagine a group of people holding the edges of a large blanket, and there's a heavy ball sitting right in the middle of it, right? The whole blanket is distorted by that ball. If you're a practitioner trying to fix a localized problem, you can't just reach in and move the ball without acknowledging the entire fabric of the fascia is pulled taut around it. But we get so focused on our one specialty. One provider says it's spinal curve distortion. Another one says it's dysautonomia. Another one says it's an emotional trauma response. And the truth is, it's all the same blanket. It's all the same elephant. And when you have a tool that can move the ball, it's incredibly tempting to use it immediately. We want to do a chiropractic adjustment or process through or do some regulation techniques, treat it, change it. And I understand why. Like, people come to us suffering, they want help. We desperately want to help them. But the question that changed my entire practice was this: what am I actually here to provide? Am I here to repeatedly correct the downstream effects of a system that keeps recreating the same tension pattern? Or am I here to help the system self-recalibrate more effectively? And coming from a vitalistic philosophy at the foundation, knowing the body is self-healing, self-regulating, the latter was really more inspiring to me to say, how do I help the body get back into that self-healing state? How do I help it regulate itself more effectively? So most of us were trained, explicitly or implicitly, to fix things. Even if our philosophy says the body is self-healing, even if we believe in that innate intelligence, a lot of clinical training still orients around find the problem, find the distortion or the tension pattern, correct it, release it, or strengthen a weakness, mobilize something stuck. Early in my career, I really had to look at chiropractic adjusting and ask myself, am I just selling adjustments? Am I selling the fixing of a subluxation in the spine? Because if your body needed to be manually adjusted by an outside force every single time your spine got jammed up, you would need like 100 adjustments a day. Your brain actually detects and self-corrects imbalances all day long. So if I'm just fixing you, if I'm just doing the correction, I'm handing you a fish, right? I will gladly feed you. Hi, that's if you eat fish in this analogy. But like, I'll gladly feed you high quality, wild caught fish when you're starving. But my ultimate goal as a provider is really to teach your system how to fish again, right? My goal is to shift your nervous system out of chronic alarm so your system can go back to recalibrating and healing itself by default. Now, I don't know how to make us not ever need any outside help, but I have found that taking this approach is so much more rewarding for my purpose as a provider, and also, of course, results in such greater practice success because so many more people I can care for by helping their system get back into that recalibration and healing mode. Because, right, it's like if the body is self-healing and self-regulating, which we know it is, then my job can't only be to fix what is off kilter. My job needs to include asking, why is the body not self-correcting this already? Right? Why is the system stuck in alarm? Because a system stuck in alarm is not going to prioritize self-healing. Right? So why does this pattern keep coming back? What is the body protecting? What does this person's nervous system actually have the capacity to receive today in this moment when I have this person in front of me? And this is the clinical lens I I would love for more providers to have, because if we only chase the downstream effects, the restrictions, the tension, the subluxation, the emotional pattern, we can end up working incredibly hard on these downstream expressions of a deeper protective strategy. And that is exhausting for us and for the people we serve. This is one of the reasons that providers burn out. It's not only because they're working too many hours, it's also because many providers are carrying way too much energetic responsibility for change. They're trying to make healing happen, trying to get the release, trying to get the adjustment to hold. And I want to say this with so much compassion that over efforting comes from love. I know it does. It comes from being the kind of person who cannot bear watching someone suffer. But over time, if your model of care depends on your constant output, your body will eventually start telling the truth. So I'm talking about a different way of practicing, one that honors the intelligence of the client's system and protects the provider's system as well. So let's get practical. Why do otherwise good techniques not work sometimes? And one reason is that the system is in defense mode. So when the body perceives threat, It prioritizes protection over growth, healing, integration, and repair. So if you apply a technique into a system that is already near capacity, the body may treat that input as another threat, even if your technique is right, is otherwise a good thing. Even if the tissue really does need to change, even if the adjustment was specific, even if the release was anatomically brilliant, or even the psychological, like belief shift or habit shift, is the right thing. The question is, was the system available to receive that? I know this intimately because I've lived it as a patient. When I was in my early 20s going through chiropractic school, I was collapsing with drop attacks 30, 40 times a day. All my muscles would randomly just turn to mush and I would fall down. My heart rate would skyrocket. I'd almost pass out. It was a complete mess. And I sought out some of the most highly skilled, competent, top of their field upper cervical chiropractors in the world. They would take an x-ray, look at the top bone in my neck, the atlas, and say, your atlas is jammed over to the left. We need to adjust it. And they would. And post x-ray, it would be perfectly centered. It was mechanically brilliant. Except for 30 minutes after every single adjustment, for that whole 30 minutes, I couldn't walk. I could barely talk. It took all of my effort just to breathe. Every time I was adjusted, these highly esteemed doctors would tell me, you're probably just retracing. Your body's integrating the adjustment. You're having a healing crisis. But that wasn't true. What we discovered later, when I finally had an upright MRI instead of laying down, was that my brain was herniated out the base of my skull from a car accident back when I was a kid. The left side of my cerebellum, the lower part of the brain, was herniated further than the right side. My atlas was shifted over to the left on purpose to protect the part of my brain that was sticking out. My body was using structure as a splint. And when those brilliant doctors adjusted my neck, they were mechanically pushing my atlas directly into that herniated part of my brain. My nervous system responded with absolute terror, shutting my entire body down into a survival freeze response. Thank goodness I did not suffer any permanent injury, but it's a glaring example of how we as providers can be mechanically correct and neurologically disastrous. And that's not from any wrongdoing or bad intention. It's that we're not being taught this in school. When we villainize the brace, when we assume that tension, tightness, subluxation are just bad things that need to be ripped away, we ignore the fact that the body is doing something often profoundly intelligent. That tension is often a crutch allowing a deeper injury to heal. And if you kick the crutches away from someone who still has a sprained ankle just because the crutches limit their range of motion, you're going to re-traumatize them. Because if you kick the crutches away, you'll get a temporary change followed by a rebound. This is what I call the boomerang effect. The tissue might release and then tightens again. The nervous system settles and then flares. The body gains range and locks back down. You might temporarily shift a habit and then revert. And the provider often thinks, I didn't do enough. Maybe I need a stronger technique. Maybe I need to go deeper. Maybe I need to see them more often. Maybe I need to find the more hidden thing. But sometimes the system doesn't need more. It needs better sequencing. It needs safety before release. It needs proprioceptive feedback before intensity. It needs presence, returning home to the body before processing. And this brings us to a critical distinction that every provider needs to understand. What looks like resistance to your input is often saturation. When we try to apply our technique and the body fights back, we often think, well, they're just resisting change. I need to distract them. Wiggle your toes. Take a deep breath. Just let me get in here and fix this. And even as a patient, we often go, it's okay, they're doing the right thing. I'm just going to mentally check out and let them get in there. But when input exceeds a system's availability to process it, force becomes incredibly expensive, honestly. This is why you're exhausted at the end of your clinical day if you're a provider using force to try to make change happen in these systems. You're literally pouring your own life force into a system that can't absorb it. Worse, when a patient's system is overwhelmed, they will often utilize one of their most brilliant survival mechanisms, dissociation. They numb out. They go into a functional freeze, this dorsal vagal collapse, just to tolerate the input of the therapy, especially if they're a high-functioning person who is very good at enduring, especially if they want it so badly to get better that they'll let you do almost anything if they believe it might help. So they'll check out mentally and say, just do it, just fix me. But if their consciousness is not present in their tissues during the process, the brain won't update its map of self. The identity of the system doesn't change. So if the system doesn't claim that new pattern, you might successfully loosen the tension, and tomorrow the brain's going to put the exact same tension pattern right back because it wasn't even present to learn the new way of being. And this is one of the most important clinical distinctions I know. Is the person present? Because if they're not, the change might not integrate. So the question isn't just, can I create a release? The question becomes, can this person stay present enough to receive the release? Can their nervous system recognize this change as safe? We have to stop dragging our patients kicking and screaming into health. We have to start partner dancing, right? We need to learn how to read when a system is at capacity. So in neurofascial flow, the number one skill that we teach providers is called somatic tuning. Just like a musician can hear if a note is a little sharp or a little flat before the entire song falls apart, you can learn to feel the physiological signs of a nervous system just tipping into alarm. You can feel the tissue tone change. You can see the breath get shallow. You can watch the peripheral, you can check peripheral vision and see it narrow. Pain tolerance is a terrible metric for healing. The only metric that matters really is nervous system capacity. If we want to stop playing whack-a-mole, we need a clinical operating system that honors the body's readiness. And that's why I say complex cases don't need a protocol first, they need a map. A protocol asks, like, what do I do for this condition? A map asks, what is the system protecting? Where's the load? Where's the safest point of entry, the point of access? Now, most techniques out there go straight to step 3 of what should be this 5-step process. Step 3 is actually making the change. But inside of NeuroFascial Flow Method, we don't just follow some cookbook recipe checklist. It's more of like a choose your own adventure book. So we use a fractal 5-step framework that allows you to plug your unique technique artistry into it. Step 1 is establish safety. We don't jump straight to the fixing thing. We use the body's built-in language for safety, which is proprioception, which comes from deep pressure and movement. We feed the starving brain safety signals so it can dial down the fire alarm. Step 2 is facilitate a softening. So we're not forcing the system open yet. At this point, we are inviting it. We ask the system, like, are you ready to let go of this crutch? And we wait for the system to willingly drop its guard. Then step 3 is activate change, but only to the system's capacity. So this is where your specific technique comes in. It might be fascia release. It might be an adjustment. It might be therapeutic processing. But you only do as much as the system can integrate without triggering alarm. And that's where somatic tuning can help you to find where that edge is. Then as soon as we hit that edge, it doesn't matter if maybe you've only changed 10%, loosened 5%, whatever it is, at that point, as soon as you hit that edge of the nervous system just tipping to alarm, you stop what you're doing, you reestablish safety. That's step 4. So all change is stress, right? Even good change. It's always hard. So immediately after whatever we do for change, we bring back the proprioceptive safety signals. And step 5 is integrate and adapt. This is where the system learns really to inhabit the change. We do gentle, intentionally unintentional movement called pendiculation and let the brain make a new map of itself so it doesn't immediately default to its old locked down neuromotor pathways. And this framework is fractal. It applies to a single moment, a session, a 12-week process, a whole arc of care. It even applies to a business model because the basic truth is the same. Change that exceeds capacity often triggers protection. Change that is sequenced through safety and then readiness, activation, reassurance, and integration has a much better chance of holding. So let's bring this into a real clinical style example. Maybe the neck is not the doorway that you can access today. Maybe the neck is the alarm bell. And if we keep trying to silence the alarm bell without understanding why it's ringing, the system may turn it back on over and over. So years ago, I had to close my clinic for 3 weeks and travel to another state to take care of this 35-year-old woman who'd been unable to leave her apartment for 5 years. She was like, 5'6", 85 pounds soaking wet. She was just skin and bones. She'd been chronically ill for a very long time. She had profound sensory overload. She couldn't even handle the sound of dishes being washed. She was a woman in extreme distress, and her body was locked in a massive state of alarm. When I went in, I couldn't just start releasing fascia or adjusting her spine. It would trigger alarm for me to even touch her feet. The alarm started there, and I had to work with it and cycle through the 5 steps multiple times. For the first few days, the entire thing was just establishing safety. And her system released some of the fascial tension on its own that she'd been holding for literal decades without me touching it. Because if I had tried to physically force a release, it would have overwhelmed her system. But when we worked with safety signaling, we were able to have the system release itself, which is so powerful. This is also why the provider's presence matters so much, because a complex system in a state of alarm will often sense whether you're trying to force it. Even if your words are kind, even if your technique is gentle, if your field is saying, I need you to change so I can feel successful, I need this to work, the system may still go into that protective state. And so this is where the work becomes so much more sustainable because you're not carrying the whole transformation on your shoulders. You are facilitating the conditions for the body's intelligence to come online. That's the difference. And it makes all the profound change in the world. I also want to speak to the providers who are so tired. Because many of you are not tired because you don't care, obviously. You're tired because you care so much. You can feel the gap. You can feel the people that are carrying more allostatic load, more trauma, more nervous system dysregulation. And so you keep adding tools. You keep trying to learn more techniques, more stuff, more supplements, more stuff that you can do to help them, more crutches, to help them handle that stress. But what you might actually need is a clinical operating system, a way to decide what to do first, a way to know when not to do the thing you technically know how to do, and a way to stop selling your time and output and start facilitating transformation through a clearer container of care. This is part of why I created NeuroFascial Flow Method, not just to give people another technique, but to offer a clinical lens, a way of sequencing, a way of honoring the body's protective intelligence. So, if you're a provider watching this and you recognize the pattern, the clients who rebound, the cases you keep thinking after hours, like, what do I do? How do I help these people? I encourage you to start asking some different questions. Not only, what technique should I use? But what is this system protecting? Is this person present enough to integrate change? What is the earliest sign of alarm? What input creates more connection? Am I trying to fix a downstream tension pattern or facilitate the system to heal itself? Those questions are the beginning of a different kind of clinical mastery, one that is less exhausting, is honestly more precise. My favorite quote is, "Magic is just science not yet understood." I've dedicated my career to learning the exact science of the nervous system and the fascial web so that we can deliver those magical, miraculous clinical outcomes much more consistently. Because the body is not a machine to dominate, and you probably already know that, but school indoctrinates that kind of approach into our techniques. And I don't think that we were ever meant to just do the change techniques. If you look at any great master, they're automatically using these steps. And it was actually only because I had to go so slowly with some extremely traumatized people that I was able to say, okay, these are the 5 steps that we are doing in order to help people. And you can use them to troubleshoot. You can use them to be more intentional and use this sequence to really open up the correlation, the coherence between what your grounding philosophy of innate intelligence is with the work that you're doing, how you're supporting and partnering with the intelligence of your clients. If this resonates for you as a provider, I've linked a clinical thought piece below. And if you're ready for a deeper training pathway, you'll also find information about the NeuroFascial Flow certification. If this work resonates, subscribe so YouTube knows to show you future videos and so this paradigm can reach more practitioners who are ready to stop micromanaging the healing process through effort and start facilitating the body's intelligence. I'm Dr. Satya Sardonicus. This is Human Coherence. I'll see you in the next video.